One of the comments or concerns that often comes up with people starting a new fitness program is either causing pain and injury or exacerbating a current sensitive area or current pain. One of those common areas is the low back. So what I want to touch on today is some of the mechanisms of things that can cause some discomfort in the low back. Some of those mechanisms can be things like what muscles get tight and what muscles are weak. For example, one of the things we'll talk about today is a muscle in the low back called your QL or your quadratus lumborum. Basically, it's in your low back in between your ribs and your pelvis, and it kind of holds everything in that low back together. The other thing that we're going to talk about today on the anterior side, the front side of the body, is our transverse abdominis and how we can strengthen that to create some stability and support for the low back. Right? Now, this guy can get tightened up because being the name quadratus, which means four, right? It works in all four directions. So when it tightens up, there's no real one position that gives it relief. So what I like to do is take a version of child's pose that allows us to get it into flexion, right? To lengthen it, and lateral flexion to lengthen it in kind of the most common positions that it will tighten up. So we're sitting back in our heels, right? And then we're going to take our chest towards the floor and we're going to extend our arms as far forward as we can. Now we might just get to sit in this position and this is enough here. But if we want to get into that lateral flexion to stretch that QL, we're going to use our hands and walk to the side. Enough till we get a nice stretch all down the lateral side of the body. Then we're going to stay here for, 3 to 5 deep breaths. Once we're done 3 to 5 there, we're going to walk the hands to the other side till we get that nice stretch in the side body. And again, stay there 3 to 5 breaths. So once we've stretched the muscles that are tight in the back, we want to strengthen the muscles in the front to help stabilize the back. And our main muscle that we use to do that is called our TVA, our transverse abdominis. Basically, it comes across, kind of side to side across the abdomen. It kind of acts like a girdle. It's basically what creates the pressure in our abdomen, and that's going to be the big thing that we want to do. We want to create some what's called intra-abdominal pressure to help support the low back and help to support the rib cage and pelvis when we move. So one of the tricks that I like to do for this is just what I call a supine brace. For the supine brace, we're going to be on the floor on our back in a neutral spine position. And what I mean by neutral spine is just a slight curvature in the low back. I don't want you to push your low back into the floor because, as you can see, as I do that, that rotates my pelvis and takes us out of position, right? We want everything to be neutral. Neutral for the low back is just a little bit of extension. Once we're in that position, you're going to bring your knees up over top your hips. You're going to place your hands on your knees, and all you're going to do is just gently push your knees into your hands and push your hands into your knees. When you do that, you should feel some pressure be created in your abdomen. That's what we're looking for. When that pressure is there, what I want you to try to do is set your legs down. See if you can recreate that pressure without pushing your hands into your knees. Once we're able to recreate that pressure without pushing onto our knees, this is our core stability. So now whenever we squat, lunge, push up, plank, this is the focus, creating pressure here. Now that we've taken some of that tension out of the back and we've created some stability through the core, I want you to take that with you everywhere. Think about things like sitting down at your desk or at the kitchen table, unloading the dishwasher, walking the dog, things like that. These are all the common little things that happen where we accidentally or unexpectedly feel a low back flare up. So I want you to take this with you everywhere and make it a conscious effort. It will get easier and you will have to think about it less, but at first we gotta put some thought into it.